Intranatal question 1. A client is not progressing with dilatation during labor. Her physician recommends cesarean birth to minimize the potential of fetal distress. After surgery, what should the nurse assess for this client? Select all, apply. A. Infection. B. Hemorrhage. C. Hematuria. D. Mastitis. The correct answer is A, B, C. Infection, hemorrhage, hematuria. 2. A Prometric Haad Dha client is admitted to the labor and delivery area assessment reveals that she is in the early part of the first stage of labor. Her pain is likely to be most intense. A. Around the pelvic girdle. B. Around the pelvic girdle and in the upper legs. C. Around the pelvic girdle and at the perineum. D. At the perineum. The correct answer is around the pelvic girdle. 3. A new nurse tells the charge nurse that she is comfortable assessing the fetus from the fetal monitor strips. How should the charge nurse respond? A. Don't worry about it. Last shift stated that strips were normal. B. The physician will be back soon. He will make an assessment. C. I will go with you to interrupt these strips and then we look at several others. D. I will reassign you to a client without monitor. The correct answer is C. I will go with you to interpret this strip and then we look at several others. 4. A client's partner asks the nurse whether he can do anything more to help his wife during labor. What should the nurse suggest? A. Encourage her to talk during contraction. B. Frequently ask her how she feels. C. Provide helpful distraction. D. Ask about the progress of other client. The correct answer is provide helpful distraction. 5. A client in labor is receiving oxytocin. The electronic fetal monitoring strip shows contraction occurring every 30 seconds to 2 minutes. With an intensity of 90 mmHg and increasing resting tone. How should the nurse respond to these findings? A. Administer oxygen as ordered. B. Call the physician. C. Check the fetal heart rate. D. Discontinue the oxytocin infusion. The correct answer is D. Discontinue oxytocin infusion. 6. Because cervical effacement and dilatation are not progressing in a client in labor, the physician order IV administration of oxytocin. Why must the nurse monitor client's fluid intake and output closely during oxytocin administration? A. Oxytocin causes what? A. Intoxication. B. Oxytocin causes excessive thirst. C. Oxytocin is toxic to the kidney. D. Oxytocin has a diuretic effect. The correct answer is A. Oxytocin causes what? Intoxication. 7. At 40 weeks gestation, a client admitted to the labor and delivery area. She and her partner are worried about the fetus health because she had a problems during her previous childbirth. The nurse reassured them that the fetus will be monitored closely with the electronic fetal monitor on the fetal monitor strip. What is the single most reliable indicator of fetal well-being? A. Persistent fetal tachycardia. B. Fetal heart rate acceleration of 20 beats per minute for 15 seconds. C. Normal baseline fetal heart rate. D. Normal contraction sequence. The correct answer is B. Fetal heart rate acceleration of 20 beats per minute for 15 seconds.